The recent chapter in the long-standing conflict began with a significant escalation. On October 7, 2023, Hamas and other Palestinian armed groups launched an attack on Israel. This attack resulted in the deaths of 1,200 people. Additionally, more than 200 individuals were taken hostage. The scale of this event was unprecedented in recent history for the region. It immediately set the stage for a massive Israeli response. The world watched as tensions already high reached a boiling point, leading to widespread fear and uncertainty about what would come next for the people living in both Israel and the Palestinian territories. The initial shockwaves of this attack reverberated globally, signaling a new and devastating phase of conflict. Israel's response was swift and severe. Airstrikes began almost immediately, targeting various locations across the Gaza Strip. These were soon followed by ground operations. The stated aim was to dismantle Hamas's military capabilities and secure the return of the hostages. However, the intensity and scope of these operations have had a profound impact on the civilian population in Gaza. Densely populated urban areas became battlegrounds. The infrastructure, already fragile from previous conflicts and a long-standing blockade, faced immense pressure. The military actions created a rapidly deteriorating humanitarian situation with civilians caught in the crossfire and struggling to find safety amidst the widespread destruction unfolding around them. The human cost, particularly for Palestinians, has been staggering. As of October 2024, reports indicate a horrific number of casualties. UNRWA figures stated that by October 22, 2024, at least 42,718 Palestinians had been killed in Gaza since the conflict began. Amnesty International reported that by early October 2024, this number included over 13,300 children. The sheer volume of deaths paints a grim picture of the conflict's brutality. Beyond the fatalities, the number of injured is also overwhelming. UNRWA reported 100,282 Palestinians injured in Gaza by late October 2024, with organizations like the International Rescue Committee noting that around a quarter of these injuries could require lifelong care, placing an unimaginable burden on individuals and the healthcare system. The crisis has also led to massive displacement. An overwhelming majority of Gaza's population has been forced to flee their homes. Reports from Amnesty International and UNRWA indicate that nearly 1.9 million Palestinians, which is around 90% of Gaza's total population, have been forcibly displaced. Many of these individuals have been displaced multiple times, moving from one supposedly safe area to another, only to find danger following them. By October 2024, a staggering 84% of the Gaza Strip was under Israeli evacuation orders. This constant movement and lack of stable shelter has exacerbated the suffering, leaving families exposed to the elements and ongoing hostilities, searching desperately for security that remains elusive. The scale of displacement is almost unimaginable. The humanitarian conditions in Gaza have been described as catastrophic. The entire population, over 2 million people, is in dire need of humanitarian assistance. Amnesty International paints a picture of starvation, relentless bombardment, and severe restrictions on humanitarian aid. Israel's intensified blockade, imposed after October 7th, cut off or severely limited essential supplies like electricity, water, and fuel. These are critical for survival and for the functioning of basic services. The International Rescue Committee has highlighted how Israeli restrictions on the entry of aid and the movement of humanitarian personnel have severely hampered relief efforts, creating an environment where help cannot effectively reach those who desperately need it. The obstruction of humanitarian aid is a critical factor worsening the crisis. Less aid entered Gaza in the last 3 months of 2024 than at any other point during that year, according to the International Rescue Committee. For instance, UNRWA reported that only 552 humanitarian trucks entered Gaza between October 1st and October 20th, 2024. This is a fraction of what is needed to sustain the population. Furthermore, between October 1st and 21st, 2024, Israeli authorities reportedly facilitated only 6% of aid movements to northern Gaza, an area facing extreme deprivation. Military operations, particularly in Rafah, have further choked off aid corridors, making the delivery of life-saving supplies nearly impossible and perilous for aid workers. This lack of aid has directly led to severe food insecurity and widespread malnutrition. Over 90% of Gaza's population is facing acute food insecurity. The International Rescue Committee has warned that famine is likely imminent, especially in northern Gaza. An Integrated Food Security Phase Classification report from October 17, 2024, indicated a persistent risk of famine. It stated that 1.8 million people were experiencing acute food insecurity, with a shocking 133,000 people in catastrophic food insecurity, which is IPC Phase 5, the highest level of crisis. This means people are starving, and without immediate intervention, widespread death is inevitable. The situation is particularly dire for children. The consequences of this food crisis are devastating. Acute malnutrition rates, especially among children, are reported to be 10 times higher than pre-war levels, according to UNRWA. The lack of basic sustenance is not just a matter of hunger. It leads to long-term health problems, stunted growth, and increased vulnerability to disease. The economic impact is also severe. The Consumer Price Index in Gaza has surged by 283% since October 2023. Food prices have skyrocketed beyond reach for most families. For example, potatoes in northern Gaza were reported to cost up to 66.7 times more than before the conflict, illustrating the desperate struggle for basic survival. The health crisis in Gaza is spiraling out of control. Hospitals, which should be sanctuaries, have become part of the battlefield, or are simply unable to function. According to UNRWA, as of October 2024, only 17 out of 35 hospitals in Gaza were partially functioning. Even these facilities operate under unimaginable conditions, facing severe shortages of water, sanitation supplies, personal protective equipment, and critically, power due to the fuel blockade. Doctors and nurses are working tirelessly with minimal resources, often having to make heartbreaking decisions about who receives care. The strain on these remaining facilities is immense, as they try to cope with overwhelming numbers of casualties from the ongoing conflict. The collapse of essential services like clean water and sanitation has led to a surge in infectious diseases. The International Rescue Committee has reported significant increases in conditions such as polio, hepatitis A, and diarrheal diseases. These illnesses spread rapidly in overcrowded shelters where basic hygiene is impossible to maintain. The lack of clean water forces people to consume contaminated water, further exacerbating the health risks. While organizations like UNRWA have made valiant efforts providing over 5.87 million medical consultations and vaccinating over 193,000 children in 2024, the scale of the need far outstrips the available resources. A planned third phase of a polio vaccination campaign had to be postponed due to escalating violence, highlighting the impossible conditions for public health initiatives. The destruction of infrastructure across the Gaza Strip has been widespread and unprecedented. Amnesty International states that the offensive has leveled entire cities and destroyed critical infrastructure. This includes homes, schools, water pipelines, sanitation networks, and power grids. Large parts of Gaza have been rendered uninhabitable. The International Rescue Committee has also reported widespread destruction of civilian infrastructure. This systematic dismantling of the essential fabric of life means that even if the fighting were to stop today, the path to recovery would be incredibly long and arduous. The environmental contamination from destroyed buildings and unexploded ordnance will pose risks for years to come, making rebuilding a monumental challenge. The very people trying to alleviate the suffering, aid workers, have themselves become targets or casualties. Over 350 aid workers have been killed since the conflict escalated, according to the International Rescue Committee. This includes more than 250 UN staff, the vast majority of whom were Palestinians. UNRWA specifically reported that 233 of its staff members had been killed by October 2024. UNRWA premises, which are supposed to be protected under international law, have been repeatedly impacted. There have been 464 incidents affecting UNRWA premises, including 74 instances involving military use or interference by parties to the conflict. Tragically, at least 563 internally displaced persons sheltering in UNRWA installations have been killed, and 1,790 injured. The scale of the devastation and the conduct of hostilities have led to serious accusations from the international community. Amnesty International, in a comprehensive report, concluded that Israel is committing acts prohibited under the Genocide Convention against Palestinians in Gaza. Their findings are based on extensive research, including interviews, fieldwork, analysis of evidence, and official statements. The organization pointed to killings, the infliction of serious bodily and mental harm, and the deliberate imposition of conditions of life calculated to bring about the physical destruction of the Palestinian people in Gaza. Amnesty also investigated 15 specific airstrikes and found no evidence they targeted legitimate military objectives, raising further concerns about adherence to international humanitarian law. Legal responses are slowly taking shape on the international stage. The International Court of Justice, the UN's top court, has issued provisional measures ordering Israel to, among other things, enable the provision of urgently needed basic services and humanitarian assistance to address the adverse conditions of life faced by Palestinians in Gaza. However, organizations like Amnesty International state that Israel has largely ignored these ICJ orders. Separately, the International Criminal Court prosecutor announced applications for arrest warrants for senior Israeli leaders, including Prime Minister Benjamin Netanyahu and then Defense Minister Yoav Gallant, alleging war crimes and crimes against humanity. These legal actions underscore the gravity of the situation and the growing international pressure for accountability. In response to the unfolding catastrophe, there have been numerous and increasingly urgent calls for action from international bodies and humanitarian organizations. Amnesty International has called for an immediate and sustained ceasefire. They urge an end to what they term genocide and demand that states, particularly the USA, Germany, EU member states, and the UK, stop arms transfers to Israel. They also call for the ICC to consider adding the crime of genocide to its investigation and for states to arrest individuals wanted by the ICC. Furthermore, they implore the UN Security Council to impose targeted sanctions and an arms embargo to address the crisis effectively and ensure accountability. The International Rescue Committee echoes the call for an immediate ceasefire. They advocate for a comprehensive humanitarian reset. This includes opening all border crossings for aid, streamlining inspection processes to allow for a massive scale-up of assistance, ensuring the safe and unimpeded movement for aid workers, and restoring essential services like water and electricity. UNRWA's Commissioner General Philippe Lazzarini has repeatedly called for an immediate truce to enable safe humanitarian passage, especially for civilians trapped in northern Gaza. The overwhelming consensus among these organizations is that without a ceasefire and unfettered humanitarian access, the suffering of the Palestinian population will only deepen, pushing them further into an abyss of despair and destitution.